Welcome to Toledo Clinic TV. My guest for this segment is Jacob Spellis. He's the CEO and owner of Vital Health. Tell us what Vital Health is. It's a relatively young organization in town. What do you do?
Yeah, thank you so much for having us today. It's a pleasure. Vital Health was always a big vision of integrated healthcare. So some of the gaps I've seen as a social worker for over a decade would be quality and speed of services. A lot of times staff would have the mindset, I don't work for you, I don't do that. So we always want to have that quality integrated care. We're an outpatient facility located in Maumee, Ohio. We provide pretty much every service on outpatient basis for kids and adults. So from ambulatory detox, partial hospitalization programs, IOP, counseling, case management. And then for our children, we offer kind of similar services with after-school programs, counseling, case management in the homes as well.
And so how do people find you, or how do people get your services?
Yeah, there's a lot of various ways. There's sometimes people are forced through court, sometimes people are coming through children's services, unfortunately, but a lot of times, people might be visiting our website or just give us a simple call and kind of inquire about that. And we try to make the transition as smooth as possible because there's a lot of stigma and just uncomfortableness for somebody to reach out and get help.
Okay, and what's the connection with Toledo Clinic? There's a partnership that you've been forming?
Yes, so a little bit ago, we had some of our gaps in services. So, a lot of the data will speak to with somebody with mental health will lose 9 years off their life for not taking care of their physical health. High blood pressures, they're not getting MRIs. So when we met with Tom specifically, we wanted a partnership where we'd be able to work back and forth together where we assist with some of the behavioral needs and they help with the more intense physical health specialists and so forth.
Okay, let's talk about that stigma a little bit. You mentioned that. How are people overcoming that, and how can you help them do that?
Yeah, I'll give a personal story. I'm a person that suffers from mental health, substance abuse. I was a homeless youth at 16 years old, and even as a professional, I owned a business at this time. People would blow me off, say it was mental health, and I had a full-blown chondrosarcoma tumor in my face, and this kind of led to some of my stigma of mental health because I'm like, hey, I'm a business owner, I've been through this, and they're like, no, you might just be drug seeking or you might just be doing this, but I knew I was sick, and when I went to other facilities and stuff, I always remember that top quality care to treat everything as a health condition. So that's why it's not called recovery, mental health, something, it's vital health because every disparity in the healthcare field, we take vital.
Okay, and you have a program specifically for youth. Tell us about that.
Yeah, so currently rough right now season, but we offer a summer behavioral camp. So if you think about all the youth that maybe got in some trouble in school, they didn't make it to the other traditional summer camps, we put a camp together where we have licensed professionals, case managers, behavioral techs, social workers, nurses, crisis case managers, where we work through this youth through a 10-week curriculum, evidence-based program where they work on anger, self-esteem, and so forth. And we kind of integrated there where they're learning, going through these services, but also experiencing the same things, field trips. Everything's based on a behavior performance, so they have to get a certain amount of stars, do a certain amount of stuff, work on their treatment plan goals in order to go on trips and so forth. So right now we currently had 70 kids sign up through our program. It's been going well. Right now we're doing it at a local church in Maumee, and it's just been a blessing to work with these youth this summer.
It sounds like you're meeting a huge need in this community.
We're trying. The job is hard. We just meet the children, and we're trying to work with so many different community partners. A lot of our children are in group homes. A lot of our children might hurt themselves. They might have adjustment disorders coming from stress, maybe moving a lot. ADHD, autism, just a lot of various different problems that we work with them to give them that one-on-one time so there's no academic lapse when they go back to school.
That's great. Well, it was great to chat with you for a little bit, Jacob.
Yes.
Appreciate it.
Thank you so much.